These are the components for the GI and GU portion of a head-to-toe assessment. You want to keep the patient supine or laying flat on their back. You should inspect or look at the abdomen, auscultate or listen to bowel sounds in all 4 abdominal quadrants, palpate or feel all 4 abdominal quadrants, ask if the patient has tenderness while palpating, and then ask questions about the last bowel movement and urination. You also want to palpate or feel the bladder for distension.
So for the GI assessment or gastrointestinal assessment, we want to look, listen, then feel. Inspect, auscultate, palpate. So first we're going to inspect or look at the abdomen. We'll note any bulges, masses, pulsation, symmetry, the contour, basically anything abnormal we're wanting to note and to chart. Then we will auscultate the abdomen. We'll be listening to all 4 abdominal quadrants for about a minute in each spot. We should be hearing about 5 to 30 sounds. The order that we'll be doing this in is right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, following the way of the GI system. Next, we'll palpate, which is feel, each abdominal quadrant and note any tenderness. We can ask our patient to voice to us if there's any pain when we're palpating. We also need to ask a couple of questions. The first question we'll ask is when their last bowel movement was, and then we're going to ask COCA. COCA stands for color, odor, consistency, and amount of their last bowel movement. We can take our patient's report of this as long as they're oriented. If you don't hear any bowel sounds when you're auscultating the bowel sounds, this is a medical emergency. You should listen for about 5 minutes before you decide that a patient does not have any bowel sounds. Also, when you're doing a GI assessment, they must lay flat.
When assessing your abdominal quadrants, remember when you're speaking about the right or the left, we're referring to the patient's right and the patient's left. Another way to remember the order for listening is to start in the patient's right lower quadrant and then move clockwise.
For the GU assessment or genitourinary assessment, we have a lot of questions and we'll palpate. So for the first question we'll ask is when their last void was, the last time they urinated. We'll also be asking COCA about this, but one of the C's have changed. So we have color, odor, clarity, and amount of their urination. They can also report this, or they may have a urine specimen. The next thing we want to ask is questions about their urinary experience. So that'll be if there was any frequency, urgency, hesitancy, straining, or dysuria, which could also be pain while they're urinating. If they have any yeses to this, we'll want to note that. The next question we need to ask is if they need to urinate right then, because we're about to palpate their bladder. If they need to urinate, palpating their bladder may make them void in the bed. So lastly, we'll palpate the bladder. We'll note any distension or tenderness. We should not be able to feel the bladder when we're palpating on a patient with an empty bladder.
Thank you.